Hi, my name is Gina Terranoni, and I'm the owner and clinical director at the Dova Center here in Boulder County, Colorado. I'm a licensed acupuncturist and herbalist for almost 20 years now, and I specialize in women's health care and chronic pain. And today's topic that we'll talk about is endometriosis. I'll give you a brief history, some of the Western medicine diagnostic tools and treatments, also discuss Chinese medicine diagnostics as well as treatment. And ideally, the best treatment is the holistic co-treating of both Western and Chinese medicine, as well as talking about some self-care tips that would be helpful for you if you suffer from endometriosis. So first, let's look at what is endometriosis. And endometriosis is the presence of endometrial tissue outside of the uterine cavity, commonly associated with chronic pelvic pain, and it occurs in young women of childbearing age. The endometriosis is the endometrial tissue outside of the uterus, and it responds just like your menstrual cycle does to hormones. So it has the fluctuations of building up, maturing, and then sloughing off and bleeding. So the history is it first was diagnosed in 1920s, but a lot of the symptoms were documented as early as the 1800s. And up to 30% of women suffer from endometriosis. So some of the symptoms are internal bleeding, scar tissue, and debilitating chronic pain. But some of the more common ones that we see in our clinic are debilitating pain during periods or in between periods, pain with intercourse, pain with bowel movements, a diagnosis of infertility, fatigue, exhaustion, constipation, low back pain, headaches, dizziness, nausea, upset stomach, heavy bleeding, which could lead to anemia. So usually our patients go to a Western doctor first and get their diagnosis, which usually will start with a pelvic exam or ultrasound or maybe an MRI. But hands down, the best diagnostic tool is a laparoscopy. And treatment for Western medicine is usually pain medications or hormone medications and removal of the actual tissue. But the challenge is this only offers a temporary fix, as research shows. Generally, the tissue does come back. So that's the beauty about adding in Chinese medicine with Western medicine. We offered a patient-centered care, and we want to understand how endometriosis is impacting the patient's life as well as their body. So we treat according to the different types of endometriosis as diagnosed in Chinese medicine, but we do see that the main cause is blood stasis. But in addition to that, we'll ask you a number of questions about your lifestyle, about your habits, eating, sleeping patterns, digestion, bowel movements. Is the pain sharp? Are you fatigued? Do you run really warm? Do you run cold? Does your pain respond better to heat? Does it respond better to cold? And what we'll do as far as treatment goes after we come up with a solid diagnostic is we'll put you on a treatment plan, most likely using acupuncture, herbal therapy, foot soaks, and herbal medicine. And the nice thing about blending Chinese medicine with Western medicine is that if the pain is so unbearable, you can, and some people will have their endometrial tissue removed, and Chinese medicine will help to prevent it from growing back. Also, it'll lessen the pain. One of our incredible acupuncturist, who's also an endocrinologist, Jane Littleton, who's out of New Zealand, writes extensively on this topic, and she recommends having an ultrasound before you start Chinese medicine treatment just to get a nice baseline, and then about 6 months later having another ultrasound just to see how far you've come and how you've progressed with treatment. And also it's a nice indicator for us to see if we need to adjust your treatment plan at all. So lastly, I'll talk about some self-care tips that support endometriosis and pain relief. So things that you want to avoid specifically during your cycle are intercourse, swimming, excessive and strenuous exercise, don't use tampons, and just avoid emotional or excessive emotions in general. All of this interferes with proper blood circulation throughout the entire body. Eat foods that are easy to digest, such as steamed foods, avoid greasy foods and hard to digest foods, and definitely focus on foods that are high in B and C vitamins. And any kind of stress reduction technique that you can add in, so light exercise, being out in nature, deep breathing exercises, and meditation. Working that into your life in general, not just during your cycle, will be incredibly helpful. So, just to recap, now you've got some tips on how to manage your endometriosis at home, but you also know that the best care to consider is integrating both Western and Chinese medicine. So, try to find a Western doctor who is supportive of integrating both of these medicines for your treatment plan because you will have the best outcome in that way. A lot of research is headed that way and supports this. So if you're local in Colorado and you suffer from endometriosis or know someone that does, feel free to set up a free consultation with me at the Dova Center, and you'll find our information below. Again, my name is Gina Terranoni. I'm a licensed acupuncturist and herbalist and also the clinical director at the Dova Center in Louisville, Colorado, where we treat women who suffer from endometriosis. Please click on the link below for more information, and thank you so much for watching, and we'll see you soon.